Good morning, and thank you for joining us. Today we're going to talk a little bit about workplace concussions. Now, a bump on the head, a slip and a fall where your head hits the ground, or even a whiplash, all of those can cause a concussion, and all of these things can actually happen in the workplace. Dr. George Morris, a sports medicine physician here at CentraCare, he joins us to talk about the dangers of concussions in the workplace, how they can be prevented, and if they happen, how they can be treated. So thank you for joining us.
Thank you, Karna.
Yeah. Now, many people equate concussions to sports injuries, whether it's football or soccer or something like that. So how can a concussion actually occur in the workplace?
Well, thanks, Karna, for bringing up this topic during, Brain Injury Awareness Month. March is a good time for us to kind of go over these issues and how they affect us and what we can do about them. So I do agree that a lot of times we think of concussions in sports with kids. However, we have a lot of adults that are working in environments where they are at risk of getting a head injury, a concussion. We think that probably at least 40% of concussions happen due to a fall. Other ones happen 15 to 20% from hitting an object, such as a shelf or a cupboard. Many others happen from car accidents, driving a vehicle, which could be work-related, and others happen from an assault or an injury. We do have a lot of professionals that work in jobs where they have to restrain people, they're security guards, they're police, they're fire, so they can be in a situation where somebody's trying to do harm to them, and that can sometimes result in a concussion.
What are some of the common, again, you kind of went over this a little bit, but common causes of concussions outside of those assaults in the workplace, or even for somebody that's in kind of an office setting? How could it happen?
Thanks. A lot of times here in Minnesota, we know looking outside right now, there's a lot of ice and snow. So the slip and fall is probably the most common one for either when we're walking to work or from work, and if we're still kind of on the work setting, that's a big one. For many people that have to work outdoors, that's a risk. There are rare times that you'd see a slippery floor, that can happen and falls do occur. For people that work at heights on ladders or scaffolding, that's a big risk. Many times they'll have safety features to try and prevent those types of injuries, but falls are probably the biggest one. I think other ones are car accidents. We think of our drivers, delivering objects for us. That's a concern, that they would get into a car accident while on the job. Other ones might be that something hits you. If you're working in a warehouse or a store with pallets stacked up, well, what if one of the pallets or a box from them falls down and you're underneath it? We all try to be careful at work, but unfortunately, accidents do happen.
How long after suffering a concussion can a person see symptoms when they can appear or when they could start to worsen?
Thanks, and that's a good question about the timing. Many people will say symptoms or concerns right away. You get your head hit, you'll have a headache, trouble with vision, balance, or thinking, or even occasionally you get knocked out and go unconscious. Though that doesn't have to happen for you to have a concussion or a head injury. And we also see people that have the injury, they report it to their supervisor, they report it to work, we know when it happened, we know what happened, and it can be even a week or more than a few weeks later that the symptoms develop. One of the reasons why we think that might happen is you could say that, well, if during the fall I also broke my arm, I'm going to be paying more attention to my broken arm. And my headache, my balance, my vision may not be the primary issue. And so it takes a little time for that to become more of a problem. Some people also just have delay because they've been coping, they've been managing, and they're just kind of fighting through it until their body kind of wears out or wears down, and the concerns they're having become more of a problem.
Now, let's say the concussion doesn't happen to yourself, but how can you tell if maybe a colleague has suffered a concussion?
Good question about what you can look for in others. I think it's important to remember when an accident does happen, be sure you're safe in the workplace. So make sure that there's not going to be another risk for the person or the others. And then things you can look for are changes in their behavior. Let's say they come to work the next day, they're not as bright and smiling and shining as they usually are, they're not as engaging, they're a little bit more withdrawn, so some behavior change, maybe a little bit more edgy. Those are things you could look for. Somebody that's maybe having more trouble with computer screens, looking and paying attention. A person might be more forgetful than usual. If they're had reports due, and they're usually really good about doing that. They might be struggling to keep up with their workload, kind of falling behind. So I would look for those changes from somebody, especially in work. Usually you know a lot of people that are in your work setting, and that can be one thing to look for.
What should you do within the first few minutes if you think you've suffered a concussion at work?
I think a big factor if you are worried about a concussion is look for your surroundings and make sure you're safe. If you're safe, then go ahead and think about, now what do I need to do for my next steps. Typically in a work setting, the workplaces would have policies or guidelines about what to do for reporting it. So I think that's probably a good one to think about, is work with your supervisor about what your policies are for reporting it. I think keeping track of your symptoms and keeping track of how they impact your job is a big concern. There are people that can have a head injury or a concussion. It'll go away quickly, they won't miss a lot of work time, and they'll be able to do their usual job, even while they're recovering. But for others, it becomes a major barrier to staying effective on the job.
How do you know if you should seek medical attention, or should you just kind of, wait and see?
I think there can be a little bit of a wait and see approach that many people take, and that's all right. As long as it's mild and you're doing well, and if you need accommodations, you can do that. But most of the time for the work setting, we like people to get evaluated or at least discuss it with their supervisors. After that, I think if the symptoms are starting to affect your life, your work, your sleep, how you're feeling, your mood, you should be evaluated by a professional that knows both the work setting and eventually knows work and concussion care.
How long can it take to recover from a concussion?
Well, that's a hard one to determine, Karna. Concussions sometimes for people will go away within a week, kind of self-resolve, a little bit of treatment is needed, and then you can kind of get back to your usual life. Unfortunately, we also have people that have had a concussion in a work setting, and it's long-term, meaning 6 months or even permanent, where we need to have modifications to work, adjustments to their load, adjustments to their daily schedule. We see that the brain injuries that happen, especially for repeated ones, become more and more of a problem. We're seeing more and more research about what's called CTE, or chronic traumatic encephalopathy. Again, this might be one that is more linked with the NFL football players. Challenge is that's their job, so they're really having brain injury on the job. For other of us that aren't professional athletes, we can still have head injuries and that then add up over time. You might say ones that I had as a hockey player growing up, and then if I get one on the job, they're just going to add up, and we could see long-term challenges.
How important and what should you communicate to your employer when it comes to concussions?
I think some of the big things that are important to talk about with your employer are how the concussion is affecting you. For some people, it might affect them more with balance, working and manipulating if they're doing a fine, manufacturing job or a job where they need to have using their dexterity, their hands very well. Others, it might be more that I can't look at my computer screen the way I used to. The light is bothering me. The overhead lights are bothering me. And those kind of challenges can be addressed with your employer with what are called the workplace modifications. I think it's important to realize that if there's a goal, we'd like to keep you at your workplace in a safe way as possible, with more of changes to your work environment instead of just don't show up.
How can I prevent concussions among my colleagues? What can be done to prevent them?
I think a lot of them will come down to safety issues. If you see a spill on the floor, warn people, address it, put down some cones, or clean it up. If there's ice outside, be warning, be careful. Talk about the prevention things that you can do ahead of time. Wear your protective gear. If you're in a hard hat environment, don't go without a hard hat. If you're working at height, make sure you're doing it in a safe way as possible. So I think a lot of it will come down to being safe, following your workplace environmental programs, and then being aware of each other. You have to look out for each other.
That's great. Well, that's all the questions that I have, but so Thank you so much, Dr. Morris, for all this information about workplace concussions. Now, as you had said, March is Brain Injury Awareness Month, and we hope we can bring a little bit of increased awareness about how concussions can occur when you're on the job. Now, there are more resources on concussions and brain injuries, and you can visit Project BrainSafe's website at brainsafemn.com. And again, thank you so much for joining us, Dr. Morris.
Thank you.